Hi, everyone. Thank you for taking the time to attend our Medicare Planning webinar. My name is Surin Barsumian, and I'm your host and founder of SMB Financial Strategies. I want to start with a statistic that you may already know. 10,000 people turn 65 every single day. That's a lot of people. But why is that important? Well, because 65 is the age in which you qualify for Medicare. The objective of today's presentation is as follows. We hope that you will have a better understanding of Medicare basics, coverage, and costs. We hope that you will be able to describe Medicare Part D, which is the outpatient prescription drug program. We hope that you'll be able to identify the differences between original Medicare and Medicare Advantage. And finally, to be able to summarize the coordination of benefits. I'm going to start with a brief introduction about Medicare, and then I'm going to turn it over to our presenter, Mike. So what is Medicare? Medicare is a federal program that provides health insurance and is an important element of a comprehensive financial plan. There are two different ways to receive Medicare, either via original Medicare, which is the traditional program offered directly through the government, or Medicare Advantage, which is a private plan that contracts with the government to provide Medicare benefits. Sometimes people get confused between Medicare and Medicaid. It is important to know the difference. Medicaid is a separate government-run health insurance program for those with limited income or assets. There are no income requirements to receive Medicare. In today's presentation, we are going to focus solely on Medicare. We will not discuss Medicaid. So as you can see here on your screen, Medicare is divided into 4 parts: Part A, Part B, Part C, and Part D. Mike, can you go into the specifics of the different parts and the services that they cover?
You either decide to take part in Part A and B through the federal government, have original Medicare, and pick up a separate Part D prescription drug plan or a supplemental plan, which we'll talk more about, or you decide to enroll in Part C, which is Medicare Advantage, again, run through private companies. And Part C will have all the benefits included in Parts A, B, and D. So that's the breakdown. Now it's about who is eligible. And eligibility depends on several factors, including age, work history, citizenship status. And this slide reviews a few of the ways that you can be eligible for Medicare. And you can see here that it's broken down into 2 categories: those who are over the age of 65 and those under the age of 65. For 65 or older, the simplest way to qualify is if you qualify for Social Security benefits or railroad retirement benefits. This, essentially means you've worked 40 quarters or 10 years, you're paying Social Security and Medicare taxes here in the United States. And you can also qualify if you're over 65 and you're a current U.S. resident and meet certain citizenship or length of residency requirements. So over 65, the most typical way to get coverage. You can get covered for if you're under the age of 65 as well. The operative word here is going to be disability. Most likely you've received a Social Security disability annuity or check in the past and have been receiving these checks for 24 months. So, people who have ALS and end-stage renal disease, those are a couple other instances where you can also qualify under the age of 65. But again, if you're over the age of 65, you have to meet the requirements I mentioned before. If you're under the age of 65, again, there's typically some disability involved, and you're probably well aware if that's the case. So you're eligible, right, for one of those 2 scenarios here. So what type of benefits do you actually receive? So what we're going to talk about next is, as mentioned, original Medicare, Part A and B, and some of the costs and coverage associated with it. As you're going to notice, we're going to first discuss original Medicare, which again is run through the federal government, and then get into Medicare Advantage plans, which are generally covering the same things as original Medicare, but will have different costs or coverage rules and sometimes offer these additional benefits as well. So to get into the different parts of original Medicare, let's start with the obvious, Part A. And so Part A generally covers inpatient or hospital insurance. You'll see the words inpatient and outpatient quite a bit throughout the at least first part of the presentation. And the distinction between the two, as you might already be aware, inpatient simply means that a doctor has formally admitted you into a hospital. Outpatient, which we'll see in a second here, simply means you have not been formally admitted into a hospital by a doctor. And that decision is made by the doctor themselves. So you have as the beneficiary, you have no part in determining whether it's a Part A or Part B type situation, right, as far as coverage is concerned. But as far as the beneficiary is concerned, that basically determines who pays for what. If they're admitted into the hospital, Part A is covering your care. If not, then you are outpatient, and Part B will cover your care. And so you can see from the image here, Part A covers things like inpatient hospital care, which is care you've been provided after you've been formally admitted. Inpatient skilled nursing facility. Think of this as short-term post-hospital extended care. Give you an example. A patient goes to the hospital for knee surgery, then goes to a skilled nursing facility after for physical therapy. This will be covered by Part A. There's home health care. Use the same example. Say you've been deemed safe to return home after knee surgery, and instead someone is coming to your home to provide that physical therapy. Hospice care, another example, care for people who are terminally ill. Again, Part A will cover your inpatient hospital type services as mentioned here. So after inpatient, we got to make sure we talk about outpatient and Part B. So Part B covers the doctor, the medical, the outpatient services, which means you have not been formally admitted into a hospital by a doctor. These are things like doctor services, actually emergency room visits, preventative care. Think of that as care that is used to keep you healthy, like your annual physical or yearly blood work. Home health care, durable medical, which just means the physical items like wheelchairs and walkers, and actually emergency ambulance transportation as well. So Part A, again, is your inpatient services. Part B is your outpatient. And that is what rounds out original Medicare as far as what you're covered for. Now, what might throw you off is there's a bunch of services we have not mentioned, right? And these are services that people care a lot about, whether it's dental care, vision care, routine hearing. These are the three that probably attract the most attention and get the most questions. Am I not covered for these items? And, you are, or you'll find a way to, rather, meaning, you either go to a private insurance company and pick out the separate policy. It's called a supplemental policy, which we'll get into, or you go with Medicare Advantage. So there are ways to get covered for these services, but these services are not included in original Medicare. Another one that is not included is long-term care, which is a catch-all term that really means care for people who are often very, very sick and unable to leave their home. So long-term care is not included either. So again, these are services that are uncovered through original Medicare, but you will find a way to get coverage, whether it be through a supplemental plan or Medicare Advantage plan, which we promise to get into in a few moments here. And with all this coverage, hate to say it, it's not all free. There are costs associated with getting covered under Medicare. And so here we have both Part A and B costs. And there's a deductible for Part A and B. For Part A, you pay an inpatient hospital deductible, which comes out to $1,408, $1,408. And then for Part B, it's $203 per year. Again, that is the deductible. Part A has no premium, so long as you've been working 40 quarters or 10 years or more in the U.S. Then for Part B, there's a standard premium of $148.50 a month in 2021. Part A and B also have co-insurances, which means percentage of the cost of service. Part A, you will pay an inpatient hospital and skilled nursing facility daily co-insurance. And for Part B, it's split 80-20. What that means is Medicare will pay 80%, and you will be forced to pay 20%. $100 bill, right? You pay $20, Medicare pays $80. Again, these are typically the costs associated with most forms of insurance that you've probably heard of before, whether it be the deductible, the premium, the co-insurance, but it's a big part of Medicare as well. And, again, these are the original Medicare typical costs. And there's a way to manage these costs a little bit better or a little bit more predictably. And we'll explain what that means. So Medigap, which is also known as supplemental insurance, you might have heard me say supplemental before. They're health insurance policies that offer benefits to work with original Medicare. These plans only work with original Medicare. This is not Medicare Advantage, right? So your supplemental plans, your Medigap plans will work alongside original Medicare, that Part A and B. So two different things between this and Medicare Advantage. And these are supplemental plans that pay part or all of the remaining costs after original Medicare, right? So we just mentioned a co-insurance. A Medigap policy will pay that 20% co-insurance as an example. These are offered through private insurance companies. They charge a monthly premium as well. But again, they do create predictability as far as everything we mentioned on this prior page here. All right, so this is your Medigap coverage. You can typically purchase Medigap in two separate periods. Number one, during the 6 months beginning the month you're 65, once you have enrolled in Part B, so Part A, Part B, then your supplemental plan. This can be also known as your open enrollment period, which we'll discuss shortly. Or you can get your supplemental plan within 63 days of losing certain types of coverage if you're 65 and up. This is called your guaranteed issue right. So again, there's the ability to get this Medigap coverage to help complement and work alongside what original Medicare typically covers. And there's great resources out there for you as well, such as the Department of Insurance or SHIP, SHIP, to help you learn more about how to purchase a Medigap policy in your state. So covered Medicare Part A and B, spoke a little bit about supplemental plans, otherwise known as Medigap. Now we're going to skip over C and go to Part D, right? Just as we mentioned before. So this is your drug coverage under Medicare. And Part D, as mentioned, is the part of Medicare that covers outpatient prescription drugs. And what they mean by outpatient prescription drugs is simply drugs that you receive at a pharmacy, right? So each Part D plan, they'll actually have a formulary, which is a list of covered drugs. This will lay out your brand name drugs, your generic drugs, and your specialty drugs. But there's a formulary that tells you what this Part D plan covers, literally medication by medication. And Part D is offered through private companies. I mentioned before, it's either offered through private companies as a standalone plan or as a set of benefits actually included in the Medicare Advantage plan. So to be clear with that, you can get original Medicare, which is Part A and B, and then get a standalone Part D, as in David, plan to help with your prescription drug coverage, or you get a Medicare Advantage plan, which will be all-encompassing. And we'll touch again on that in a moment as well. Just like Part A and B, there are costs associated with your prescription drug coverage. Every Part D plan will be different with regards to costs, to coverage, but we give you some rough estimates here as far as what to expect, right? So in 2021, the maximum deductible was $445. The national average for the premium was $33.06. And lastly, the co-insurance, the co-payment, that truly will vary by plan to plan and by the drug that you're receiving. We mentioned the formulary, right? So this is how Part D plans use different tiers to price drugs. And as you can see here, this is a pretty simple tiering structure. The lower tier is your generic brand drug. The higher tier is your more brand name or specialty drug. What you should do is generally look for the plan that covers the drug you use on the lowest tier. That makes it most cost efficient. Because again, no Part D plans are alike. And you want to get the Part D plan that covers your medication in the cheapest fashion. There are certain coverage restrictions. We won't talk a lot about this, but things that you probably experienced before, right? Whether it's private authorization, limits on refills. You probably heard about step therapy, where you try generic and then step up to a specialty drug. But again, there's certain restrictions and things you might want to be aware of as well as you purchase your Part D plan. My recommendation is simply get a plan that meets your personalized needs. Don't assume that the plan from your neighbor is one that might fit you. Get one that fits your needs. So talked a lot about original Medicare, Medigap, again the supplemental policy, as well as Medicare Part D. And now we go back, right, to Part C, being that of Medicare Advantage. And, I know we've already gone through this, but just to make sure we got a full-on handle about it, original Medicare offered through the government, Medicare Advantage offered through private companies, right? So Medicare Advantage is offered through private companies, includes Parts A, B, and usually Part D. However, the costs, the restrictions, they do vary by plan to plan. So there's a lot of difference as you go from plan to plan. And just to review coverage, Medicare Advantage must cover Part A and B services. Must cover Part A and B services. And they may also cover some of those additional services that we saw earlier that are not covered by original Medicare. These are the ones that probably threw you off, right? The routine vision, the dental, the hearing. These are often the services that beneficiaries are looking into when they purchase a Medicare Advantage plan. They want something that's all encompassing, and Medicare Advantage plans can afford that for you. One thing to keep in mind, and we'll get into this in a little bit as well, Medicare Advantage plans might have different premiums, co-payments, max out of pocket, versus your typical original Medicare. Medicare Advantage can also cover some non-health related benefits, as you see here. The examples may include, the meal delivery, the transportation, the home air cleaners, etc. Typically, when you get this coverage, it means you have a certain ailment that would allow you to get coverage from these more supplemental benefits that can work alongside Medicare Advantage plans, but not as typical in the scheme of things. So we talked a lot about original Medicare and Medicare Advantage, and this is where maybe you pay attention like 10% more on this beautiful sunny day here in New England. What plan is best for you? Right? So we talked about original Medicare and Medicare Advantage. So we'll give you a brief comparison between the two, right? And it's important you understand, your Medicare coverage and choices, and you got to pick this coverage carefully. Not that you can't go back and forth, because you can, but you want to make sure you get it right on the first time. So the most notable differences between the two are as follows. Original Medicare allows you the most flexibility in that you're covered to go to nearly all doctors and hospitals in the country. On the other hand, Medicare Advantage plans typically have network restrictions. That's probably a phrase you've heard before with your insurance. The Medicare Advantage plans will typically have network restrictions, whereas original Medicare is flexible all around the country. Everyone's going to take it. Another important thing to consider is original Medicare doesn't require you to have a referral to see a specialist. Medicare Advantage plans will require this. That's typically a big one. We know how hard, especially over the past 15 months, it is to get a referral to see that specialist. And again, original Medicare will not require you to have that referral. Medicare Advantage plans, and this is a big one as mentioned before, they'll provide those additional benefits that original Medicare does not cover, right? The routine vision, the dental care. Again, the other side to this is there's ways to get coverage, excuse me, if you have original Medicare through those standalone plans, the supplemental, the Medigap that I mentioned before. And those are typically pretty reasonably priced. And lastly, and again, this might be one of the more important ones, original Medicare will typically have higher caps on the out-of-pocket costs relative to Medicare Advantage. So flexibility, the referral, the additional benefits, and then that out-of-pocket, those are the four components that folks typically consider when deciding between those two plans. Again, we will, in the resource guide, the follow-up material, we'll provide you with this material again, so you have the information in front of you. Some questions to ask yourself when you're considering these plan options. Do you travel often? Right? Original Medicare is much less restrictive on network providers than Medicare Advantage. That's here in the U.S. If you go outside the U.S., actually neither original Medicare or Medicare Advantage will actually cover you outside the U.S., but there are ways to get that coverage through supplemental plans. What type of insurance do your providers accept? Right? Check with your doctors and networks to find out. Easy recommendation. Give a call over as to what they accept. What type of services do you need? Do you go to the dentist a lot? Do you have glasses or contacts? Right? That's another question to ask yourself. And then the costs, right? Are you willing to pay up for maybe a little bit more flexibility, or are you trying to make it as cost efficient as possible? Remember this: not one size fits all. Everyone's situation is immensely different, and you have to find a plan that fits your personalized needs. So, talked about the coverage, the differences between the two. Now, how do we get set up with this thing in the first place? So let's talk about how you enroll. And enrollment is one of those topics that can create nerves and anxiety around the process as well, because there's deadlines and dates you need to be aware of. But the good news is the U.S. Postal Service and advertisements on TV make you very aware that you should probably be enrolling at this point in time. I know you get a lot of material in the mail that definitely keeps you in the loop in the scheme of things. But there are three periods where you can enroll in Medicare: your initial enrollment period, your special enrollment period, and the general enrollment period. And I'll touch on each of these briefly because, they are easy enough to look up online as far as what they are. But the initial enrollment period is a 7-month window where you can first sign up for parts A and B. So this is the period where most beneficiaries are going to enroll. It starts when you turn 65. Once you're enrolled in parts A and B, you may select a Part D plan or choose to enroll in Medicare Advantage. But the first step is enrolling during original Medicare, typically this happens during your initial enrollment period. This is essentially how the initial enrollment period works. Again, this is a 7-month period where you can enroll. You enroll in the 3 months leading up to the month you turn 65. If you enroll in the month you turn 65, coverage actually doesn't start until the end of the month. You'll actually have a little gap in coverage there. So if you enroll in one of the months following the month you turn 65, you'll have the most significant gaps in coverage. Just remember to roll on time. And this image here shows you when the coverage actually kicks in, depending on when you enroll. You might delay your Part B enrollment, and we'll dive into this a little bit as well. So the special enrollment period is an opportunity to enroll for those who are working and they have coverage that Part B would provide. You don't need duplicate coverage, and you don't need to pay 2 premiums for the same coverage. Just know that this is an available option for those who have job-based insurance, right? Is a special enrollment period. I would say there's a definite need to enroll on time. Don't, screw up delaying your enrollment, because actually back in 2012, 700,000 people paid a late enrollment penalty for not enrolling in Part B on time. So you want to make sure you have coverage. If you're delaying your coverage, just make sure you're set up to, again, enroll in Part B at one point in time as soon as that coverage ends. Again, when the job-based insurance ends. Then there's the general enrollment period. This is the 3-month window in the beginning of each year to sign up for Medicare. This is if you miss your initial enrollment period, and runs from Jan 1 through March 31st. Coverage kicks in July 1st. Let me just stress this. Don't get here. Enroll in Medicare on time. Avoid the gaps in coverage, the late penalties. Just get it done. Set a reminder in that smartphone. We all got one of those. So just enroll on time. When you do become eligible for Medicare, as we've discussed, there may be several options for you to choose from, and it's important to take into consideration the coordination of those benefits. And we'll touch on those briefly here, just for one slide. A common example that we see is, as mentioned, is you have this job-based insurance, but you also want to enroll in Medicare. The trick is an easy one. Coordinate with your work, with your HR, with your benefits administrator to see how the 2 plans can work together, your job-based insurance and Medicare. I can almost guarantee you someone has turned 65 and had to enroll in Medicare from your company. So they should be able to walk you through, what the best course of action is. The primary insurance pays for your medical bills, and the secondary insurance covers the co-pays. Who's primary, who's secondary between the job-based insurance and Medicare depends on certain things, actually the type of company that you're at. Again, there's this coordination of benefits to keep in mind. There's the delaying of your Part B coverage that might make sense so you don't get duplicate coverage or pay 2 premiums. Just speak with your benefits administrator, your HR, to make sure you're going about it the right way here. This is, usually the least favorite slide. We're going to talk about IRMA, which is the income-related monthly adjustment amount, something you might have heard of. It's also known as the added premium. It's also known as being a victim of your own success. And what IRMA is it's actually an added premium to Part B and D of Medicare for those that have higher incomes. Again, being a victim of your own success. The premium amount depends on your income bracket, which is laid out here for 2021. These are monthly premiums, and you see how they can step up pretty meaningfully and make Medicare maybe more expensive than you initially thought. Your income bracket is actually based on your tax returns from the 2 years prior, separated by individuals versus couples, but you get the idea here. It can definitely add up. And, there are instances where maybe you're not paying what you should. Maybe there's a life event. Maybe you sold a home, which, is qualified as income in one sense or the other. So maybe you're in the wrong bracket here, in which case you will do a new initial determination. This is a request to have it redetermined because you think you're paying more than you probably should. To get the new initial determination, you submit a Medicare IRMA life-changing event form. You schedule an appointment with Social Security. There's ways to do it to make sure you're paying the right amount. You'll actually need to provide documentation as well of your correct income or the life-changing event that took place that maybe threw off that 2 years of earnings. For some reason, IRMA does not grant you that new determination, or if you're not eligible to request a new initial determination, but you still disagree, you can actually appeal. So they afford a whole process that allows you to make sure you're paying the right premium when it's said and done. So again, that's IRMA. That's the added premium that, again, can add up. And you want to make sure you're paying the right one, or navigating the situation correctly as far as maybe some life-changing events that you have going on. So we've gone through a lot. I said we'd go through a lot. I hope you have a couple takeaways, and there will be those resources and handouts to help that we'll make sure you receive. A few quick things just to remember. Get a plan that fits your needs. Every individual is different. It's important you take time to consider your options, when it comes this time. Second, when it does come this time, enroll on time, right? Just enroll on time. The last thing you want to do is incur a penalty for late enrollment or have these gaps in coverage. So enroll on time. Third, coordinate your benefits. If you're still employed, it's imperative you know when and who pays for what. Speak to HR, speak to your benefits administrator. They've gone through it before. And lastly, know your resources. And these are just a handful of them. These are websites and phone numbers that you can call as a quick trick. Try calling during off or random hours. Sometimes you can have a big wait time if you're in maybe a state that has a lot of retirees. But these are some great resources to help you get through the process. And these are the resources that we will make sure that you receive today as well, between a resource guide and a checklist that, again, helps complement all the material that we covered here.